Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Resilience Scale assesses an individual's ability to cope with stress and adversity. It evaluates personal characteristics such as perseverance, equanimity, and self-reliance, which contribute to psychological resilience. The main purpose of the scale is to measure protective factors that support mental health in the presence of challenging conditions. It is widely used in research and clinical settings to identify resilience levels in populations affected by chronic illnesses, trauma, or psychiatric disorders. The scale provides quantifiable data that guides interventions aimed at enhancing adaptive coping mechanisms and reducing vulnerability to stress-related disorders. The Resilience Scale is indicated primarily for adult patients experiencing psychological distress, chronic illness, or those undergoing significant life stressors. It is widely used in populations with mental health conditions such as depression and anxiety to assess coping capacity. The scale is also applicable in medical settings to evaluate resilience among patients with chronic diseases, including cancer, cardiovascular disorders, and diabetes. Its clinical utility is most pronounced in contexts requiring assessment of adaptive capacity and recovery potential, such as rehabilitation programs and psychosocial interventions. Research supports its reliability and validity in diverse cultural groups and clinical populations, making it a valuable tool for identifying individuals at risk of poor psychological adjustment. The Resilience Scale consists of 25 items designed to assess an individual's level of psychological resilience. Each item is presented as a declarative statement reflecting various aspects of personal competence and acceptance of self and life. Respondents rate their agreement with each statement using a 7-point Likert scale, ranging from 1 indicating strong disagreement to 7 indicating strong agreement. To administer the scale, the practitioner provides the questionnaire in written form, ensuring the respondent understands the response format. Upon completion, the total score is calculated by summing the ratings across all items, resulting in a possible range from 25 to 175. Higher scores correspond to greater resilience. Interpretation relies on established reference values. Scores below 125 suggest low resilience. Scores between 125 and 150 indicate moderate resilience, and scores above 150 signify high resilience. These ranges enable clinicians to identify individuals who may benefit from interventions aimed at enhancing coping strategies and psychological resources. The Resilience Scale demonstrates variable sensitivity and specificity depending on the population and cutoff values used. Sensitivity refers to the instrument's ability to correctly identify individuals with low resilience, representing true positives. Specificity measures the ability to correctly identify individuals with adequate or high resilience, representing true negatives. For instance, in a study involving patients recovering from trauma, the Resilience Scale showed a sensitivity of approximately 85%, indicating it correctly identified 85% of those with low resilience. Specificity in the same study was around 75%, meaning it accurately classified 75% of individuals without low resilience. High sensitivity ensures fewer cases of low resilience are missed, which is crucial for timely intervention, while adequate specificity reduces false positive results, minimizing unnecessary stress or treatment. These metrics indicate the Resilience Scale's relative effectiveness in clinical settings for screening resilience levels. The resilience scale was originally developed in the early 1970s by Gail Wagnild to measure the degree of individual resilience, defined as the capacity to maintain or regain psychological well-being in the face of adversity. Initial validation studies involved a sample of older female adults, demonstrating high internal consistency with a Cronbach's alpha exceeding 0.9. Subsequent research by Wagnild and colleagues expanded the validation to diverse populations, including adolescents, adults, and clinical groups, consistently confirming reliability and construct validity through exploratory and confirmatory factor analyses. Cross-cultural validations have been conducted in multiple countries, such as Norway, Brazil, and Japan, revealing stable psychometric properties and supporting the scale's utility across distinct cultural contexts. Concurrent validity has been established by significant correlations with related constructs, including measures of psychological well-being, self-efficacy, and social support. Furthermore, longitudinal studies have indicated the scale's sensitivity to changes in resilience over time, bolstering its application in both research and clinical settings. The scientific literature confirms that the resilience scale maintains robust psychometric qualities, making it a reliable tool for assessing resilience in varied populations. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.